Most mainstream doctors believe that polycystic ovary syndrome, PCOS, is a disease. PCOS is, after all, associated with markedly increased risk for type 2 diabetes, hypertension, endometrial cancer, and heart disease, in addition to outward signs that include excessive facial and body hair, tendency to being overweight or obese, irregular menstrual cycles, infertility. Clin Endocrinol, OXF. Simplified 4-item criteria for polycystic ovary syndrome, a bridge too far? Indran IR1,2, Huang Z1, Khin LW1, Chan JKY3,4, Viardot-Foucault V3, Yong EL1. Author information. 1. Department of Obstetrics and Gynaecology, National University of Singapore, Singapore, Singapore. 2. Department of Pharmacology, National University of Singapore, Singapore, Singapore. 3. Department of Reproductive Medicine, KK Women's and Children's Hospital, Singapore, Singapore. 4. Duke's Medical School, Singapore, Singapore. Abstract. Objectives. Although the Rotterdam 2003 Polycystic Ovarian Syndrome, PCOS, diagnostic criteria is widely used, the need to consider multiple variables makes it unwieldy in clinical practice. We propose a simplified PCOS criteria wherein diagnosis is made if two of the following 3 items were present: I. Oligomenorrhea, 2. Anti-Mullerian hormone, AMH, above threshold and/or 3. Hyperandrogenism defined as either testosterone above threshold and/or the presence of hirsutism. Design setting and participants. This prospective cross-sectional study consists of healthy women, N equals 157, recruited at an annual hospital health screen for staff and volunteers from the university community, and a patient cohort, N equals 174, comprising women referred for suspected PCOS. Main outcome measures. We used a healthy cohort to establish threshold values for serum testosterone, antral follicle counts, AFC, ovarian volume, OV, and AMH. Women from the patient cohort, classified as PCOS by simplified PCOS criteria, AMH alone and Rotterdam 2003, were compared with respect to prevalence of oligomenorrhea, hyperandrogenism and metabolic indices. Results. In healthy women, testosterone greater than or equal to 1.89 mol, L, AFC greater than or equal to 22 follicles and OV greater than or equal to 8.44 milliliters, best predicted oligomenorrhea and were used as threshold values for PCOS criteria. An AMH level greater than or equal to 37.0 mol, L best predicted polycystic ovarian morphology. AMH alone as a single biomarker demonstrated poor specificity, 58.9%, for PCOS compared to Rotterdam 2003. In contrast, there was a 94% overlap in women selected as PCOS by the simplified PCOS criteria and Rotterdam 2003. The population characteristics of these two groups of PCOS women showed no significant mean differences in androgenic, ovarian, AMH and metabolic, BMI, HOMA-IR, variables. Conclusions. Our data recommend a simplified PCOS criteria with population-specific thresholds for diagnosis of PCOS. Its ability to replace ovarian ultrasound biometry with the highly correlated variable AMH, and use of testosterone as a single marker for hyperandrogenemia alongside the key symptoms of oligomenorrhea and hirsutism confers significant clinical potential for the diagnosis of PCOS. Copyright 2018 John Wiley & Sons Limited. Keywords. Anti-Mullerian hormone, diagnosis, female infertility, oligomenorrhea, polycystic ovary syndrome. PMID, 29,851,127 DOI, 10.1111/SN.13755.